Strides with Savni. I hope you all are doing well. Did you know your gut health might be the secret to balanced hormones, glowing skin, and vibrant health? Dr. Rohit is here to reveal how gut health shapes women's wellness in ways you might not have expected. If you haven't caught part 1 of Ayurveda, make sure to check it out for foundational insights. But for now, get ready to uncover some life changing tips you definitely don't want to miss. Let's start. So, you just touched upon Vata, Pitta, and Kapha. Can you
Yeah.
elaborate that for the global audience who don't know anything about it?
So, Vata, Pitta, and Kapha are the three main pillars of the body, the three main constituents of how the body is made. Vata basically is the person or is the dosha that is responsible for movements in the body. So, whatever, if there is stiffness, if there is pain, if there is a flow, if there is something which is called a discharge, something of that sort which is moving from one place to the other, purely the vata dosha is responsible for that. Then the digestion, the skin color, your eyes, your eyesight, everything is dependent on your pitta dosha. And the luster of your skin, your swabhava, that is how are you made up, that is the prakruti. Then how do you react to situations, or how is your well-being going to be, how is your body type going to be, how is your texture of the skin going to be. All of that is going to be identified by the kapha dosha. So the synovial fluids, the fluids between the joints, the space, the CSF that we call, the cerebrospinal fluid, all of that is going to be identified and determined by kapha dosha. So it is said that pittam pangu, kapha pangu, pangu mala dhatava. That is kapha, pitta, mala, and dhatu. All of them are pangu. Pangu is paralyzed if it is not for vata dosha.
Can you
So,
simplify that? Yeah.
so simply is that vata, pitta, and kapha. So these are the three things. The body will not function or will be paralyzed or will be coming to a standstill if only the pitta, kapha, dhatu, and mala are present in the body. If you want the body to move around, if you want something to happen in the body, if you want circulations to take place, if you want the body to work in a particular way, you need the vata dosha. So that is what is important. That is why vata are important.
So, how to know there is an imbalance between the three of this?
So our body keeps sending a lot of signals to us. You should always be open to understand that your body is sending you some signal. Simply a person who's used to working about 10 kilometers a day, he goes and sells things for 10 kilometers straight, doesn't have a problem on a normal day. But when the same person carrying the same load in the same atmosphere with the same temperature with the same surroundings is having certain problems in a particular situation, then you should identify that that particular person is going through a disease or some imbalance. If you have some particular pain, let's take pain for instance, because pain is a very normal thing. It keeps happening to everybody. If you go to the gym after a long time, if you come back from the gym after a long time, if you go to the gym after say 6-7 months and you work out like crazy for an hour or so, your muscle starts paining. That pain is the first signal that boss, something is wrong in the body. So that signal in Ayurveda, according to us, is that the vata dosha is getting aggravated. You need to stop. Similarly, when there is or fever which is seen in the body, so the simple reason for jwara or fever in a normal person is santap, that is getting angry. When a person gets angry, if you see, he tends to fall ill. The first thing that happens is he gets fever. Why? Because your pitta dosha is aggravated. Your pitta dosha is something that gets disturbed, and that pitta dosha is the thing that causes that particular fever. That is another thing. So if you've seen a person gets angry, he starts to shiver, he starts to sweat a lot, he starts to get red, he starts to show some angriness in the eyes. All of that is upon in Marathi there's a saying we say pitta khavalda. Pitta khavalda is pitta has gotten angry. That is a way of the body to express that I am angry or I am not, my pitta dosha is getting disturbed.
Got
And
it.
if a person is having stiffness in the body, saying like places of cold countries where there is a lot of cold wind blowing and people tend to get chills. So if you get up in the morning and all your bones, all your joints are frozen, you're not able to move them, then it is something which is the kapha dosha is involved.
So over here, I've been hearing a lot like there's a flu season coming up, and then a lot
Yeah.
of people have a cough. Right now, a lot of people are having cough and cold. So what dosha does it adds in?
So the thing is that in Ayurveda there is no generalized therapy. So if you have a kapha dosha that is involved, I may not be having the same thing. Both of us have cold, both of us are having productive cough, and both of us are sneezing like anything. But your sneezing, the reason may be different. My sneezing, the reason may be different. So we should not make the mistake of generalizing Ayurveda. For example, in COVID-19, we were told that drink Ayush Kadha. Ayush Kadha is something which is a decoction of herbs which was given to almost everybody. It was marketed like anything in the market, saying that that is the cure for Ayurveda, for COVID-19. Now, Ayush Kadha, the contents were all, heat generating contents. So basically, in our Indian cooking style, we use a lot of spices. So those spices were the contents of Ayush Kadha with tulasi and another honey. So when a person like me, who's a pitta, angry, for small things, who has a temper, who gets angry, who has digestive disturbances, or a person like another one who has no issues with these things. So he's chilled, he's laid back, he enjoys his life as it comes. And there's another one who's given a task and he is restless before he doesn't finish his job. So these are the three types of prakrutis. So mine, what I explained was the pitta. The laid back was the kapha prakriti, and the person who is given a task and he has to complete it before anything, and he's just he is there, he has to complete that procedure. So that person is a vata prakriti. All the three will not be having same effects with the kada, with the Ayush kada. The pitta dosha person will have adverse effects. The kapha dosha person will have good effects with that, but up to a certain point. And the vata dosha person may land up into constipation, which was the case with a lot of patients. So generally, you should make sure that the person or the thing that you're dealing with is particular. The number of people, as many number of people are there, those many number of prakrutis will be present. So those many number of presentations of the disease will be. If in the books it is given that a fever is the like, let's take the example of COVID-19. So the first three symptoms that were explained or given out were you are going to have fever, high grade fever, then you are going to have a running nose, and the third thing is you are going to have cough, a lodged cough or a productive cough, and then you're going to lose the smell. But virus understood we need to get better. He mutated, he changed his family, and the symptoms changed. Next time, in the next wave, people did not have fever, people did not have productive cough, they did not lose their smell, but still they were COVID-19. And there were people who were showing different symptoms for that particular disease. So we used to say that you are clinically positive, but The paper does not say that. So clinically positive is important. The diagnosis has to be done by an educated physician. If you are talking about Ayurveda, you cannot work with, Google diagnosis or WhatsApp university diagnosis. You cannot do that.
Can you explain the WhatsApp University? What do you mean by that?
So there are a lot of people who call themselves as influencers or health and wellness experts. They have read about a few things. I don't blame them. They are earning their own things, but then the things that they share gets a problematic thing for everybody else. Like I explained to you, Ayush Kadha. People who did not have any background of Ayurveda, who did not have the understanding of Sanskrit, of what exactly has it been derived from, the shloka that was given for that particular disease, no understanding of that, and they have written what not for that particular disease. They have said that this disease causes a lot of impotencies, a lot of miscarriages. Then this is the disease that is going to cause, the dwarfism to come back again. Then I have had patients show me that COVID-19 is going to shrink your kidneys, your limbs are going to go down. If you take that vaccine, that particular vaccine is going to, lead into death of that patient. So these are the things that are, which we call the fake narratives. That is the fake narratives that are being built, and people spread information. And what happens is, if I want more clicks, I just send it to, and I just add one line: send this to your 10 next friends and you will have a blessing from God, or you'll have Lakshmi walking in your house. So me being a poor chap, I believe that Lakshmi is waiting for me, and that the moment I hit the 10th person, she's going to just ring my bell and say, "Hello, boss, I'm here." So that doesn't happen. So people keep spreading such things. When they spread such things, it becomes a nuisance for the healthcare professionals, because you have to deal with the patient, you have to deal with the patient's party, that is the bystanders or the patient, the people who have brought in the patient. You have to make them understand that these are just hoax things that are being said outside. And then you have to deal with the post care, because if something goes wrong, if there is a complication because of something that he has already done on WhatsApp, people never will blame that particular post or that particular person who has sent that post, but they will blame the person who is present there. So the last person who you go to, the doctor, once you've done with whatever has happened to you, he is the sufferer. So that's why I call it universities, because people think and people learn a lot of things from that, which are 99% times wrong.
I want to ask the same question based on, like, a lot of people these days. Google has been so much helpful for me, and I'm sure for so many other people for different things. But when it comes to such kind of knowledge where you are suffering from something, and when people Google about it, it may not be correct all the time. Or these days, chat GPT, AI has become the boom, and people are using it. So what's your take on that, and what will be your advice to the audience who are really suffering from some it might be a cold or cough or a flu kind of a thing, or it could be something a little bit severe, and they are using AI or Google and taking answers from them?
Savni, you've put up a very good thing. So I'll just tell you a very short story about this. So there's a friend of mine who's a doctor herself, but a dentist. So she's not very, keen about understanding Ayurveda, but she is a good friend. So she's the first person who gave me a call and said, "Ki I have brain tumor." Okay. So may I know the symptoms? Have you done any particular scanning or something? She said, no. So I asked her, how exactly did you land up with, this particular diagnosis? Because she was a doctor, so I could speak to her freely. So I said that if it is tumor, then where is it placed? Let's think about what is the future line of action. So we went on talking about that, but then I said, hey, hang on, where have you identified that you have a tumor? So she said, I have been having headaches for the last 3 days, and there has been a pressure headache, there has been a hammer-like headache, there has been a cluster headache, and there has been a different kind of a headache which starts from the mid of the brain and goes back to the skull. So I was like, okay, did you identify all of these things? Being that is a very good observation. So she said, no, this is what Google told me. So I was like, okay, what did you Google then? So she said that, I just typed in, I have headaches from 3 days. What could I have? Now, people have to understand that our friends from the science and technology and the engineers, they have made a lot of efforts, bringing our algorithms or our search engines to whatever they are today. They have put in sweat and blood into those codings that they do. They have fed in everything that they know. So Google gives you the best possible option and not the easiest possible option. So the worst outcome is given out first. So when she said, so I asked her, didn't you see brain tumor then? She said, yeah, brain tumor, it can be cancerous also, is what Google says. So if that is the condition of a doctor, so you can imagine what happens to a common man. So the very basic thing that I would like to tell, all your audiences is that, guys, Google is a friend who you need when you need him. Google is not somebody, he's not a counselor, he's not a doctor, he's not a diagnostician, he's not a lab tester that, he's going to give you results. I've had patients, that particular HbA1c is the test for diabetes that we do. So diabetes test results are put in. I have 5.2 gram percentage of diabetes. What is that meaning? So Google says that, in India, 99.9% people are having diabetes. So he's talking about the diabetic population and not the general population of India. But then when you're reading a particular thing, that is what you read. So when you read that somebody else is getting this, I feel like, oh, now I am also suffering. Gone. The stress level goes up. And the deceased says that thank you God for the world so sweet and thank you God for the food we eat. That is what the deceased says, starts flourishing. So you have to make sure that you meet the correct person, you meet a doctor, you see a doctor. If you believe in Ayurveda, if you believe in the traditional medicine, go and see that particular person. It is not just a person of Ayurveda that you should see. I am a person who says that, it may be of the modern line of treatment, it may be the Ayurvedic line of treatment, it can be the Unani kind of a treatment, it can be Chinese medicine, whatever it is, or the traditional medicine. Whatever suits you, treats you, but does not harm your body. Please understand that it does not harm your body is something that is going to help you. A disease should be cured with something which helps cure you the disease, not cause complications out of it. So you should always, seek help from people who want to help you. So they are the doctors, or go to a lab, get yourself tested. But again, make sure that a doctor is writing a prescription for the test and not Google, because Google will give you 10,000 tests. You will you'll end up spending a lot of money when actually it was just the fast that she had done. That is what was causing the headache. She was hungry. She wanted to break the fast, but she could not because of the family traditions. So once she broke the fast, her headache was gone. So Google took a toll, saying that, she had brain tumor. So that's how it is.
So I know many people out here who are really interested in Ayurveda. They may not have anything, they are truly interested. And in this case, I don't know if it's a right thing to do and meet a doctor, because doctors are really serving people who really need help. So is there any trustable resource where they can go and check, or they can read, which is in English, of course?
So there are a lot of books available on the, or in these shops where you can buy them, you can read them. So simple books like what is Ayurveda, what is Charaka Samhita. People like, there is an English author, an Englishman who has written what is Charaka. He has not included a single shloka in that. He has just written the gist of the whole book in English. So, a person who wants to understand what exactly happens with the body, how does Ayurveda treat you, how does it deal with day to day life situations, that is a book for you. You can read that. That is just a read. But again, it is a read for the hobby. Don't develop, because there are a few things written in that which will help you in diagnosing things. But again, the matita artha or the gist of those things can be understood with a guru and a shishya. A guru teaching the shishya. So that is how you learn Ayurveda. Ayurveda is something that you cannot learn from the books. It has to be taught by somebody to you.
Okay, moving on, could you share a connection between mind and body? I saw your one of the research paper with respect to Parkinson's disease, and there I saw you had shared a connection, but I would like you to share about it more.
So my post-graduation thesis was on Parkinsonism. So there's something called as enema therapy or the Basti Chikitsa, which is Ardha Chikitsa, as explained in Ayurveda. It is the half treatment of any particular disease, if done properly, of course. So we had taken up that topic of Parkinsonism, and we were just going through, different research articles and what work has been done there. So during my preclinical trial in the rats, when I was, testing these particular things, what I identified was that the enteric nervous system or the ENS is responsible for your gut's health. Your gut's health is responsible for your ENS. And all of that is responsible for the dopamine, that is the feel good hormone that is given out in the brain. So if your gut is healthy, your brain is healthy. So that is how, like for example, if you have Parkinson's is a different case altogether, but a simple scenario where a person who has not passed the stools or has not went to the loo on a regular basis, he tends to be a little irritated, frustrated, not so happy. But on the other hand, a person who gets up, finishes off his chores, has had a good bowel movement, and is hungry and ready to start his day, his cheerfulness, his attitude, and his mind is in the right. So that is why we say that a particular system and mind is connected.
So you mentioned about ENS, and I was not able to catch what does that mean.
ENS is enteric nervous system. That is the intestine and the nervous system plexus around it. So when there is the digestion in the body does not happen properly, then the ENS is disturbed. The moment ENS is disturbed, your dopamine secretion is disturbed, because that is where your feel-good hormone comes in. And then the patients of Parkinsonism have that particular thing. They don't have a happy feeling. They're not very happy, or the expression on the face is gone. So that is because of the nerve or the disease that is they are affected with. So we say that if you treat, so in British Medical Journal there's a reference. I'll share it with your colleague, with your viewers afterwards, that British Medical Journal says that the very first symptom of Parkinsonism is constipation. So they do not say that it could be constipation, but they say that it is constipation. So long-standing constipation for more than 6 to 7 years, people should meet a doctor and see whether they have Parks or not.
Wow, okay, that is something new. Thank you for sharing that. So it clearly shows that. So what drives your passion for research? I was looking at your profile, and I saw like you have received multiple awards, like Best Paper Award at World Ayush Expo 2019, and since then you have been receiving several awards. So what drives your passion for the research in Ayurveda?
So the thing is that Ayurveda is a complete science. Ayurveda is something which is going to help you in a lot of ways. Ayurveda is something which is going to teach you how to live, how to go around things, how to, talk to people, how should your behavior be when you are speaking to your elders, how you are going to express yourself to a doctor when you are going and visiting a doctor, how should a doctor be when he is talking to the patients, how should a person who's a caregiver be when he is talking to the patients, and then how exactly is it that you treat that particular condition with what medicines. So that is how, and that is what you do. So that is, what I wanted to make sure that people are talking about and people are going through, and people don't understand that because all of Ayurveda is written in Sanskrit. So Sanskrit, the main verse is written in Sanskrit. What I understand Sanskrit, what you understand Sanskrit, what someone else understands Sanskrit, is different. The understanding may be different. What I interpret out of it may also be different. So my interpretation is based on the limited understanding I have of that particular shloka. That interpretation will have effect on what I write actually because I have to recollect what I'm writing. So it becomes a problem for me. So when I am doing a particular research, I try to simplify things so that a person who reads these papers, or an Ayurvedic doctor who is not so well versed with Sanskrit but is very keen in understanding this particular subject, he may understand this subject in a better way. So that is what is the drive I have for conducting researches. And Ayurveda has solutions for a lot of things. For example, right from why this nail is not straight, why does my nail have a fungal infection, or why my hair is getting gray, or it can be paralysis or grave diseases. So it has answers to that. You need to find those answers, and we as Ayurvedicians, we need to understand that we have to pave way for this particular thing to come into light, because modern research keeps happening. Ayurveda needs to come back, and it is a shastra of our Sanskriti. It is a shastra of our own land. Before penicillin even was derived by somebody, Ayurveda had treated millions and millions of centuries. So we have not arrived 3000 years ago. We have been here. Our, India had been flourishing even before all these civilizations. We are one of the ancient civilizations that is there in the world today. So this particular ancient civilization was flourishing because people were getting sick, people were going through some difficult conditions, people were having some problems. So what was the solution, or what was that particular remedy or the therapy that they were taking? It was Ayurveda, or it was that particular land's medicine that was being taken. So we need to revive that. We need to make sure that people come back to us, to our own therapy and system of medicine. That is what the drive is. I want Ayurveda to reach to each and everyone. That is why I do research.
So I saw some of your work, and you have worked with both modern hospitals and traditional Ayurveda. Of course, you are practicing.
Yeah.
How would you bridge, or how would you like to bridge these two worlds in future?
So when I was working with one of the reputed hospitals in Pune, I used to get calls from very senior physicians, neurophysicians, saying, "Boss, we don't have an answer to this. We don't have an answer to this particular condition. Do you have something that is going to save this patient?" So it is the approach of that doctor which has saved the patient. So when he approached, or the doctor refers that patient to me, I go and see the patient. I don't depend on the diagnosis that is written there. The patient is not available or not in a state where he can speak. And then we derive a diagnosis according to Ayurveda, and then we try to give him some medicines. So at the same time, if he has a condition of, say, congenital thing, or something which is coronary, that is related to the heart, or having high blood pressure or sugar, something of that sort, and he's already under medication. Generally, we don't discontinue all the medicines because it is not advisable. But we also say that with these medicines, you make sure that you take our medicines too, because that is, our medicines are going to help you to cure the disease, and these BP sugar medicines are going to help you keep it under control. So that is why keeping it under control and curing it is different. We attack the root cause, they attack the systemic cause of it.
So, as you were talking about the medicines, can you explain how Ayurvedic medicines are made and tested?
So in my school days, when I used to say that my parents are Ayurvedic doctors, they used to say that they are tribals or Zadpalaji doctors, because everybody used to understand that I used to think that my mother has a cape around her neck, and my father has leaves tied all over his body, and he runs to the forest, and he's a forager who forges for things and comes back, prepares medicine. So one of my friends, when he met my father, he was like, he wears a suit. I'm like, yeah, he's a doctor, he wears a suit, man. So he's like, no, then you're an Ayurvedic doctor, how do you wear a suit? I said that it is not something that we do it in the forest. The forest helps us bring medicines to us. We formulate those medicines and make it into formulations. So people have notions, that Ayurvedic medicines are harmful. They are very costly. But the problem is that these medicines are costly because we need to procure these particular medicines in a particular season. You need to, go through how the medicine needs to be processed. What are the symptoms? You need to see in that particular tree to make sure that this is the right choice of drug. Then you need to make sure that this particular tree is taken from that particular land. So according to the places, the medicine changes. The potency of that particular medicine changes. So we have to make sure that the best potent medicine is procured. So when that medicine needs to be procured, like for example, if it is Shilajit is a medicine that is used in Ayurveda. So that can be procured only from the Himalayas. I cannot get it in my backyard. So when I have to procure it from Himalaya, I have to make sure that a person who understands what Shilajit is procuring that particular medicine for me in my desired quantity in that particular season. And then he brings it to me. I process it and formulate a medicine out of it and use it. So it's a long process. Sometimes what happens is only the roots of that particular medicine is used. For example, Shatavari or Ashwagandha. So these are the roots that are used. So when I am using the root, I am destroying the tree. So which is the particular farmer who's going to give me his root, but instead, he's not going to ask me to pay for the plant, because his earning is going to get lost. So he charges me for that root at the rate of the plant. So that is how the medicine gets costly.
Wow, that is interesting about how the medicines are procured and made. So are they made in your lab or they are made somewhere else?
So Ayurveda has a saying that every Ayurveda doctor should procure his own medicines, and he should make sure that he uses his own medicines. So he's dispensing, preparing, collecting, and manufacturing his own medicines. So yeah, I have a setup at home, which is for our in-house clinic, which we use. So it is an in-house setup. So we prepare the medicines that we need. We prepare it in small batches so that we don't need to have the worry that this medicine may get destroyed or may lose its potency. So we prepare it in small batches. But yeah, while procuring it, we have to procure it in a larger quantity. It becomes cost effective for me and for the patient.
Okay. Now I'm going to take the questions which I actually asked in the community, and they were really excited that an Ayurvedic doctor is coming up on the show. And it's about the women's health. Many people requested to ask you, what is your perspective on PCOD and PCOS, which is right now very common in all parts of the world?
So Have you heard the term, that a grandmother has delivered a baby, or, an older lady in the past years delivered a baby at the age of 52 or 51? But nowadays we see that, the perimenopausal, the premenopausal, or the menopausal ages have come down to as low as 38. So the reason for that is lifestyle. The ladies that, were our grandmothers, our great grandmothers, you know, most probably our in-laws, have grown in a generation where they have worked themselves. They have worked throughout the house. They used to, have the household chores be done. Then they used to go out, earn for their living, come back home, again cook food which was fresh, and then eat it, make sure that it is finished by the end of dinner, and wash the utensils, keep it to a side. Next day morning, again prepare fresh food. So, preparing fresh food, working out properly, and working around the lifestyle is very important. Like I told you, our engineers and everybody has done a great job in inventing machines and making our life easy. But this particular thing also turns out to be a bane for a lot of ladies because their life has gotten easy in terms of these particular chores. I'm not being, harsh towards the ladies that they should not have the gadgets or they should not have the luxuries, but that is how their body is prepared, or that is how their body has been constituted together. She being needs to be a mother for a particular thing which has been inseminated into her, or which has formed as a small womb which is this big and turns up into a baby. So if she is responsible for giving birth, she has to make sure that that particular organ which is going to give birth someday stays healthy. So in Ayurveda, the PCOD and PCOS are linked again to the flow or the Vata dosha, and basically the Apana Vayu. So Apana Vayu is something which is responsible for Malasarana and Raja Pravrutti. So Mala is the fecal matter that is thrown out of the body. So the urge that you feel to go to the loo and pass your motions, and the pain that you feel or the flow that you feel during your menstrual periods, that the flow has started, that is because of the Apana Vayu which is responsible. If your Apana Vayu, which is basically in the lower umbilical region, in that particular area, in that surrounding area, if that is not stimulated, that is when the lazy bowel syndromes, the laxative intestines, the indigestion issues, the problems of constipation, and these particular gynecological problems like infertility, PCOD, PCOS, continuous miscarriages, recurrent miscarriages happen in a lot of ladies. That is the reason for that. Also, if you, because you're an Indian, you might understand that ghee or the clarified butter is something which was, a part and parcel of our lives. Nowadays, because of the health conscious people and everything, that has taken a toss and people don't eat ghee. There's a term called lactose intolerant. So they get lactose intolerant. In turn, they don't eat that particular ghee or clarified butter, and then they have these problems because, again, if you want to pacify the Vata dosha, something of the opposite dosha, that is, which is Kafakara, Pittakara, needs to be induced, or a Tridosha Nashaka needs to be induced. So that is ghee, comes up. So just a short thing I wanted to say about ghee is, people think that, ghee khane se cholesterol badhega. Ghee khane se, I'll have certain lipids or triglycerides go up. So I would like to, clarify a few things here, taking this particular platform as my way to express it to the people that it is the oil that is responsible for these things and not ghee. Because in Ayurveda, we say that anything that has been under Agni Samskara. That is something that has the Agni has worked upon it or has digested it, is not going to have problems in the body. Whereas oil does not have an Agni Samskara onto it. The Agni Samskara that we do is just during frying things. So the oil, if we use it for frying, it becomes a problem. So you were saying, what should be used by our viewers and listeners. So guys, I would like to tell you that, please use refined oil. So please use filtered or double filtered oil. Never use refined oil because it loses its own color. If it loses its own color, it loses the properties. So refined oil has some chemical which is involved, and then that is how the clear texture of that particular oil comes up. I have seen a lot of people, use oils which are not oily. The oil needs to be oily. It cannot be, less oily. It is not so. So that is the oil that causes the problem and not ghee. So if you use ghee, it is not going to cause the lipids and the triglycerides or the cholesterol to go for a toss.
So these days in the market, how to know that that particular ghee is authentic?
Oh, that is a problem. So the ghee that you get, so the best way to prepare ghee is to prepare it yourself. It's very simple. You just have to get butter, so clarified butter basically. Get it home, put it in a pan, put the flame on, listen to the sound. There's a particular sound that comes when it is boiling. The moment that sound drops, that is when you have prepared the ghee. So your ghee is ready. You can prepare it at home. It just takes about 15 to 20 minutes to prepare the ghee. So that is the best way. Otherwise, all the other big companies which generally have, ghee in that in productions, you can use those ghee products.
So for someone struggling with, because you also have expertise in IBS, and I want to talk about that as well. You did a research on that. But for someone struggling with IBS or PCOD, what would be the first steps in an Ayurvedic approach? What should they do?
So they should find out the root cause. Ayurveda does that. So IBS is nothing but irritable bowel syndrome. According to Ayurveda, the diagnosis is absolutely different. So it is Grahani Pradosha that we say. Pravahika is different, Grahani is different, Grahani Pradosha is different. There are ways. That's why, see, Savni, I would like to, take this opportunity to tell you that all the diseases that have been mentioned in the Charaka Samhita are a group of diseases or a syndrome kind of a thing that is clubbed under one roof. They are umbrella of diseases. So that particular umbrella, you need to find out which particular spoke in that umbrella is the one that fits your particular condition. So IBS is Grahani. If you say that, your diagnosis go for a toss.
What do you mean by Grahani?
Grahani is that particular, the small intestine,
okay,
or the area around the small intestine in Ayurveda, according to the Shastra, is Grahani. So that area. So there are three ways in Ayurveda for diagnosing or nomenclature of a disease. So it is according to the symptom that it shows, or it is according to, like Jwara. Jwara is a symptom. Then there is some area specific thing that happens, like Grahani. And then there is a cluster of disorders which comes together, like Gulma. That is a tumor. It can be pancreatic tumor, it can be a cancerous tumor, it can be prostate, it can be something else. Any kind of a tumor, if it is tumor, it comes under Gulma. So that is how we treat it. So it's an umbrella of diseases. That is what someone should understand and identify before treating a particular person or getting treated. So if I say that somebody has IBS, I would request them to go to an Ayurvedic doctor, get themselves diagnosed according to the Ayurveda line of medicine, and then we start the treatment for that. So majorly nowadays people are going through something which is called anxiety, stress, and a lot of imbalances in there. day-to-day emotional lives. So that also can cause the IBS. So if a person is not very happy in his day-to-day life, it can cause shokaj atisar also, because of something that he gets frightened about. Or a child, if he's being scolded by his parents, suddenly the mother or the father shouts or raises his voice. The child or the person who's getting scolded, has a passes stool or passes urine. That is called shokaj atisar. So it is because of the bhaya or shoka that has happened, a shock or the
Yeah.
trauma that has happened to that person. So that is how it is. So you need to get identified, according to the Ayurvedic terminologies in the Ayurvedic perspective, and then it is how you get treated. And there are a lot of ways. So the best medicine for this particular condition is Sanjeevani Vati. It's the Sanjeevani that Hanuman had gotten for Lakshmana according to Ramayana. So that is the name. So that which gives Jivana. Because in such diseases, you have to make sure that your Mala Sangrahana is done. Mala Sangrahana is that your stool is, it is not formed. Basically, what happens is it is not formed, it is passed in a watery kind of a thing. So it is this particular thing causes Sangrahana. So it causes it to come together and then in turn treat the disease.
Wow. Okay. Thank you so much. This was insightful. So, this is going to be the last question. There are so many questions I have about Panchakarma, about sound healing, and so on. But because we have a time limitation, I'm going to end this with this beautiful thing, which I was really touched learning about it, that beside running the clinic, you actually provided a medical care during what's called Pandharpur Palki. So, for the global audience who don't know what it is, in simple terms, imagine hundreds of thousands of people walking together on a spiritual journey. And what moved you to, like, this is something I'm curious to know, that what moved you to step out of your regular practice and to serve people during this remarkable tradition that is going on for such a long time?
So there's a spiritual aspect to it, there's a personal aspect to it, there's a selfish aspect to it as well.
Okay.
Because being a doctor, you don't get a lot of time for your daily rituals, your daily pujas, or going through your daily namaskaras, or daily things that you need to be doing for a particular spiritual person to be in place. So with the hectic lifestyle, it becomes difficult. It is not impossible, but it becomes difficult. So when we get time in these particular situations where people are going to take this religious path, or they're going to start walking towards Pandharpur, and they're going to embark on a journey which is for being one with the God. That is a chance where we get to serve those people. So it is called punya in Marathi or in our Indian literature, that you need to earn the earnest of the feelings, and you have to get the right to have moksha. So earning the right is how we give back to the society. That is how we give it back to the to God as a service, saying that, hey, hi God, we are not able to meet you every day, but then I see God in every patient that comes to me, saying that this is an opportunity for you to treat that patient and say that you have helped the person, in turn giving him some sort of a blessing, receiving some sort of blessing from that particular patient. So that is how I function. So that is my way of giving back to God. And also when you are serving for such things, during those palkis, if you as you know, but your global audience will not be knowing, that there are tens and thousands and lakhs of people walking at a time. So you do not get chance to see the actual palki or the procession of the God. So when you are serving as a doctor, you get a privilege that you can see it up front and meet the God, saying hey, thanks for being with us, and be right behind us when we treat the patients and we help them to, get better.
Is there any spiritual awakening that happened with you during this service to people?
So I'll tell you a very short story. I did not believe in a particular God. I believe that there is something which is, a God, an energy which works round the clock, which makes sure that you are getting stimulated for doing a particular thing and you are being pushed to do that particular thing. A patient came to me out of the blue, just walked into my clinic and said, I am suffering from such and such things and nobody is treating me. Will you please help me? The first thing that came to my mind was, if nobody is treating you, that means you must be having something which is complicated. So, should I take up the job? Should I, because it becomes a difficult situation if that particular patient is not getting treated properly. He may think, he may get offended, he may, land up into some complications. So, we don't want that. So, that was the first thing that came to my mind. But then something in my mind said, ki, you know what, treat him and he'll be better. It was some voice, I don't know what it was, but it just struck me. So I just asked for the files of whatever reports the patient had. And when I was going through, I saw that the patient is looking at my face and he's not looking at what I was doing. I was very curious. So the moment I looked up, can you tell me why are you looking at me? So he says, sir, I see God in you and you are my last hope. I'm just seeing whether, your expression gives me the sense whether you know what you're going through and you know what you are, in going to be dealing with. So that was something, my head, some voice told me that take up this case. And he felt that connection with me, that I was the one who's in turn it got treated. That was the patient who got treated. He has written a beautiful review on my Google a review. I would like to name him also, but I don't know if we can. So that there's a beautiful review that he wrote. I can see Vitthal in you. So that was when I understood that Palki is basically for the God Vitthal. So Vithu Mauli's seva hi tuja charanatun hota hai is what he said. So Vithu Mauli is the Vitthal God. You're serving that particular God, and we are the ones who go to that God. So that is how I got connected, and that is one of the spiritual awakenings that I had.
Yeah, so beautiful, and wow, thank you for sharing this. And I believe we will continue more on your spiritual journey, and of course to learn more about Ayurveda in our next one. Like, I would like to call you Dr. Rohit, although we know each other pretty well. But thank you, Dr. Rohit, for being on this podcast and gracing your knowledge and vulnerability, your time, everything for us. I'm truly grateful for that. And yeah, thank you.
Thank you, Savni, because this has been a great journey with you. From being friends to being my interviewer, it feels a different feeling. So yeah, it gives me great pleasure to talk to you. You giving me a platform to speak out what exactly Ayurveda is and how exactly can we make Ayurveda reach every person in this world, because Ayurveda is something that needs to be understood by everybody and it needs to be used by everybody. That is how the human race is going to get better, bigger, and beyond.
Yeah, absolutely.